Hello, and welcome back to another one of our videos on transgender allyship. So today we're going to be talking about a pretty big concept when it comes to allyship and understanding gender diversity, which is transitioning. You may have heard this term used in some contexts, so just to kind of get some of the basics out there, when we're referring to transitioning, we're talking about the process by which someone affirms their gender identity by altering their gender expression. So remember from earlier videos the difference between these two concepts. Gender identity of being more of that internal, intrinsic part of who we are and how we experience our gender, and gender expression being more so of how we show it to the outside world, how we express our gender. And that can look a lot of different ways. So it's important to realize that while there's some similarities between transitioning and coming out, it's not exactly the same thing for trans folks. So, coming out is when we're disclosing our identities to other people. Transitioning is a lot more involved. There's a lot more aspects of not just sharing this information with one or a group of individuals, but also the aspect of gender expression, of changing certain aspects of how we engage with the world, engage with our own view of ourselves. It's similar to coming out, but there's a lot more to it essentially. So today we're going to focus on some of the major types of transitioning. Most of the time, different transitions fit into the categories of either social, legal, or medical. And a big caveat that I want to make sure to lay out there before we start to get into these categories is that transitioning looks different for everyone, even two people who go through the same transition, so to speak. So thinking of maybe someone who was assigned male at birth, transitioning to express as a woman, that might not look the same way between two trans women. They could have very different journeys and decide to engage with different aspects of transitioning. So knowing that it's not necessarily a process, but in some ways a menu of who's picking what and who's doing what when. So let's start off with social transitioning. So this aspect of a transition is one that a person can typically change by themselves or with minimal intervention from others. So when we think of social transitions, this is when you're really showing other people around that I'm identifying as this gender. This is my gender. So it could look like choosing a name that affirms identity, utilizing different or additional pronouns to what you may already be using. It could be dressing and grooming self in a gender affirming way. So maybe wearing clothes that are more typical with the gender you identify as opposed to the gender you were assigned. So this is the part of the transition where people may come out to the people in their life, kind of going back to that differentiation between coming out and transitioning. This is usually the step of this is who I am, this is my identity, and this is how I'm going to start engaging with the world. Usually social transitions tend to come before other forms of transition. And just as in coming out being a process, if you've ever heard that kind of described before, transitioning is also a process. It's not necessarily an overnight, look at me, this is how I'm going to express my gender now. Especially when it comes to social transitioning. One person may start expressing as their gender identity in some contexts while remaining in the closet or choosing to express as their assigned gender in others. Maybe someone is comfortable first being out and expressing openly with their friends, but maybe not with their coworkers, and that's totally okay. Going on to another aspect is legal transitioning, which can be seen as a component of social transitioning for sure, but it often requires a little bit of those outside interventions, those outside resources. So many folks choose to legally change their names and, where possible, change their sex or gender marking on IDs, state IDs, or birth certificates. Some folks, it's important to know, don't have access to legal transitions for various reasons. When we're looking specifically at the United States, most states require that a person undergoes either a gender affirming surgery or gets a letter of support from a physician before they can change their gender markings or their birth certificates. So this can be a challenge for those who cannot or do not want to seek out medical transition through surgery. Legal transitions can be especially difficult when factoring in other documents such as social security cards and passports, because a lot of times all of these legal fees can be really costly. It can cost a lot of money to replace things that you kind of get given at birth. It's also important to note when we're talking about legal transition that it's not necessarily equal across the board either. Legal transition can be especially hard when we're talking about folks who identify as non binary or don't identify as a binary gender. There are several states that have begun to allow non binary folks to indicate an X as a marker on their gender for their gender on state IDs since about 2017. So it's very new. And with that being said, many states still don't legally recognize non binary identities. So while some people have access because of their identity to legally transition, it's not necessarily open for everyone. And going on to the third aspect of transitioning we're going to cover today is medical, which can be a place where people have a lot of questions. There's a lot of kind of ins and outs. So with a little caveat that this is going to be kind of a brief introduction, definitely worth if it's something you want to know about. There's so many resources to learn more about medical transitions. Some of the most important things, one, if you're going to take anything away from this part, is terminology is changing a lot in this aspect. A lot of us might have grown up hearing the phrase sex reassignment surgery or something similar to that, which was a past terminology that was used a lot, but now the more correct and current word that we use is gender affirming surgery. So that gets more to this aspect of you're not changing someone's sex or gender, you're affirming it, which we can definitely get more into in a whole other video for sure. So oftentimes when we're talking about gender affirming surgery, people think we're talking just about genitals, but it's important to note that medical transition can take on so many different things. So, along with surgery for genitals specifically, we also have a lot of people that opt for top surgery, if you've ever heard that term used. So, that might either look like a mastectomy, which is the removal of breast tissue, or a mammoplasty augmentation, which is when someone has breast implants inserted. Cosmetic procedures are also very common in the surgical area on either the face or neck, such as facial feminization or facial masculinization surgeries. There's also non-surgical medical procedures such as hormone therapies, hair removal procedures, and cosmetic injections that a lot of folks opt for in this area. Hormone therapy in particular is super common, and a lot of times it is a requirement before gender affirming surgeries can be done, just because there are some changes that can naturally occur just by taking hormones for about a year or so. So hormone therapy can come in the forms of pills, injections, gels, patches, most often able to be administered at home as well. The impact of hormone therapy, it can be helpful to imagine it in the way that a lot of the processes parallel puberty, which can kind of make sense when you think about that. That when someone's taking testosterone, it can promote more muscle definition, changes in voice, increased facial and body hair, more angular facial features are common as well. When someone's taking estrogen or progesterone, this promotes development of fat tissue in the face and hips. Breast growth is super common, and a decrease in muscle tone and body hair can also be common. As with other areas of transition, a trans person may not seek out most or any elements of medical transition. And this can be because of a lot of different reasons. Sometimes it's a manner of access. Access to medical care can either be super costly. Some insurance companies may or may not cover it, or for people without insurance, it might not be an option to have parts of it covered. And sometimes it's also a concern of availability. People who may live in more remote areas might not have that access to the same things that someone in Chicago might have. Sometimes it's also an unsafe environment of someone who identifies as trans, but maybe going through medical transition isn't an option just because of prioritizing their own safety in that moment. It can be a really difficult process to receiving care. A lot of treatments, a lot of different settings will require a lot of steps along the way. One of the most common being letters from therapists before getting a surgery, before going through gender affirming procedures. So it can be a lot of hoops that people have to jump through just to get this care. There can be certain risks of certain procedures, just in the way that a lot of elective surgeries can have risks involved. That's something that a lot of people consider, and some folks might not want to go through the procedures because of those possible risks. Some people might want to be a parent one day, which is something that unfortunately hormone therapy and surgical interventions can often lead to infertility or decreased fertility. So someone might either put off going through a medical transition or might not opt into it altogether because they want to be a parent. And some people may just not want to undergo surgery. Some folks want to just keep their body as it is. They might want to show their gender expression in ways that don't require surgical intervention, and that's completely okay. A trans person is no more valid if they've gone through a surgery than if they haven't. So now that we've kind of talked about all the ways that transitioning can look different, what's our role as allies? How can we support someone going through a transition? So one of the biggest things that we can start with is just showing them that we believe them. Your loved one will probably receive a lot of pushback at certain points along their transition, kind of talking back to some of those hoops or different laws that exist in different states, whether that is from people in their personal life, professional or medical professionals. They might receive a lot of messages of people that are skeptical or might not even believe them. So the more that we can affirm their gender, the more that we can do the kind of those basics of using correct pronouns, being really cognizant of using their name, showing both respect and support. It's all important to validate their identity through this process. It's also important that we're educating ourselves, like you're doing right now by listening to this video. It's okay to ask questions of our loved ones, but if it's Googleable, maybe it's good to learn on your own first. Trying to get that information before you start asking a ton of questions or trying to get your loved one to teach you, because it's important to remember that the trans folks in our lives, it's not their job to teach us. They are not required to be our educators when it comes to trans identity. Another thing that's important is offering up resources where possible, connecting our loved ones to resources that we know of, helping them find resources in the community when possible, all super important. And maybe there are other ways that you can do it, even if it's not a technical like place we know of or resource in the community. Sometimes it might be just giving them a ride to an appointment, accompanying them to a store when they're buying clothes that better match their gender identity. Maybe it's just being a moral support in scary situations. Resources can come in a lot of different forms. And sometimes the best resource of them all is just being a set of ears to listen when someone is going through a really, really difficult time. With that, it's also important to be mindful of overstepping, which is kind of similar to what I was talking about when it comes to educating ourselves. There are certain questions that you don't necessarily need answers to. Before you're asking a question of your loved one that's transitioning, it can be helpful to check in and ask yourself, does knowing this help my friend, help my family member, help my loved one? Or is it just answering a curiosity I have? If it's the latter, it might not necessarily be the most important thing to ask at that point. It's never your job to tell your loved one how they should go about their transition or what they should be feeling. Even while gaining this education, gaining this knowledge of what it could look like, this is not an invitation or advice to go telling your loved one, you're supposed to do this, or this is what you're supposed to do next. It should always be their decision. The power should always be in their hands of how their transition will look. Give loved ones space when they need it. Sometimes you may not always be the best support in that moment, and that's okay. It's not a knock on you as a person, as someone in their life, but we all need different people for different things. So understanding that in those moments. With that as well, get support for yourself. You may have a lot of reactions to finding out a loved one is transitioning, and that's also okay. It's important to find an appropriate space to process some of those feelings and those thoughts that might come up. Your loved one is most likely not the person to go into in this case for reasons that may be intuitive. So maybe instead consider journaling or finding a group for family members and friends of trans folks. Maybe it's about reading up on experiences of other allies. Or it could just be discussing reactions in a safe, confidential space like therapy. And at the end of looking at all these ways to be an ally and be supportive, it's important to know that it's not just about your loved one, which can sound a little strange at first, but hear me out here. Your loved one is a part of a larger community, and respecting that community as a whole, respecting the other members of that community, is also respecting your loved one. Advocating and supporting trans rights in a general sense, educating others on trans identities and allyship, being a supporter even when your loved one isn't there to see it is super critical. Sometimes it's helpful even to just think in those other settings, what would I be doing if my loved one was here? If I did have those eyes on me, how would that change how I interact in this situation? So it can be going back to a lot of these different aspects, it can be very hard finding affirmative care for trans folks. So one great resource you can connect a loved one to is the World Professional Association of Transgender Health, also known as WPATH or WPATH. On their website, you can find a directory of transgender affirming professionals in various disciplines, from surgeons to educators to therapists to even chiropractors. So check out this directory and other resources at their website at www.wpath.org. So in our next video, we're going to be discussing gender diverse expressions in children and adolescents. Thank you for watching, and I will see you then.